Hello, I'm Adam Shulberg, Senior Audiologist at Cubex Audiology here in central London, and welcome to your weekly tip. Today I'd like to welcome Raul Garcia. Raul is one of our team of experts and also has been an audiologist for over 20 years and has been responsible for and very experienced at oral hygiene, that's ear cleaning, ear care, removing obstructions. And we'd like to talk a little bit about this today. So Raul, what are the different methods of removing obstructions, wax, etc. From the ear canal?
So there have been several methods employed in the past, starting from instrumentation of wax removal and moving on to irrigation or syringing, and the latest method is called microsuction.
Okay, and which is your preferred method and why?
I certainly favour microsuction above any other method for several reasons. One is the fact that I have a very good visualization of the actual ear canal and tympanic membrane whilst I'm actually conducting the procedure, so there's no guesswork at all. There's also the fact that employing an ear suction device makes your life a lot easier in terms of extracting things rather than actually pressurizing the canal walls of the actual tympanic membrane when employing water jet injection. So patients find it a lot more comfortable, it's quicker, it's safer. Patients do not have to use ceraminolytics or drops prior to the actual procedure being conducted. And for that reason, it's becoming the most preferred method amongst all patients out there.
Yeah, well, I can certainly understand why. It's safe, it's quick, it's effective.
That's correct.
And also we now have regular clinics at Cubex conducted by Mr. Garcia. And if you'd like any more information or you'd like to book an appointment, then please do not hesitate to contact us by telephone or via our website, the address for which is www.cubex.co.uk. And thank you for watching this weekly tip.